Welcome to Samba Samba. Enjoy the video.
You start now. Control major bleeding by applying firm direct pressure while you ready the trauma bandage. Make sure you or an assistant opens the package and removes any protective backing. Once done, hold the sterile pad over the wound to maintain pressure. This sets the pad orientation so the dressing will cover the injury accurately. You're working quickly to prevent blood loss, so maintain pressure and keep the field clear while you prepare to wrap the limb or torso. Now you wrap. Place the pad squarely over the wound and begin clockwise or counterclockwise turns to secure it. Make sure each pass overlaps roughly 1/2 the bandage width so tension distributes evenly. This prevents gaps and reduces risk of loosening. If the bandage has a pressure bar, position it directly over the pad and tighten until you see bleeding slow. This adds targeted compression. Once stable, continue a few anchor turns above and below the wound to lock the dressing in place. Finish strong. Lock the bandage with its clasp, Velcro, or a firm knot and tuck any loose ends so the dressing won't catch. Then assess circulation beyond the dressing. Look at skin color, feel temperature, and press a fingernail to check capillary refill. These clues tell you if the wrap is too tight. If bleeding continues through the pad, do not remove the original dressing. Apply another pad on top and tighten more. If you can't control bleeding, call for emergency transport immediately.
Thanks for watching. Consider subscribing if we helped you.